Good afternoon, everybody. This is Steve Wilson at the Illinois State Water Survey, and I'm with Katie Hollenbeck from the Water Resources Center and Dan Webb, also from the Water Survey and our Public Service Lab. Today we're doing a webinar on what EHPs need to know about wells. And this class is sponsored and funded through the Rural Community Assistance Partnership and USEPA. I also want to mention that the National Environmental Health Association, NEHA, has provided a lot of support for our program, especially related to EHPs for the last several years, including with this webinar. Okay, so, well, here we go. This is part of a national program that's being implemented through RCAP, so it includes a number of partners. And at the University of Illinois, we run the private well class, which is an ongoing program meant to support well owners and stakeholders such as yourself that work with well owners. As we go through this today, we are recording this webinar, and it'll be available online afterward, probably by the end of the week. And we'll also try to get to many of the questions that were asked when you registered. We won't get to them all. And those that we don't, we'll include in our FAQ. And we'll also have time at the end. If you have questions that come up during the webinar, you can ask them in the question box, and Katie Hollenbeck is monitoring that. So I'm a groundwater hydrologist at the State Water Survey. I've worked with well owners for nearly 30 years in Illinois, and more recently, the last 3 or 4 years, around the country. Katie's with the Water Resources Center. And as I mentioned, if you ask questions in the question box on the GoToWebinar tab, she'll put those together, and we can get to those at the end. And Chuck Curtis is actually retired, but Dan Webb is here from the Water Survey's Public Service Lab, and he will take care of all the water quality and laboratory and sampling sort of things that he does. So at the Water Survey here on the campus of the U of I, we have, through our Public Service Lab, we offer sampling to private well owners in Illinois. Okay, so today we're going to talk about issues and challenges, a little bit about wells and well owner attitudes, I guess well owners and well owner attitudes, and then some about groundwater and some basics. And, I want to stress that there's a gap between groundwater professionals and health professionals. We see all the time, or I certainly do, where one side understands their side really well, but not necessarily the other side. And, the bottom line message there is that really you need to have teams of both working together to really be effective in helping well owners. So, and then at the end, a little bit about our private well class program. So there are lots of different issues related to private wells. What it really comes down to is public health protection, source water protection, and protecting water quality, and so and drinking water quality. So those things are the basic primary responsibilities we have in order to ensure that we're protecting both the environment and the folks who are drinking groundwater. There are many issues that are in the news, when Flint came up, or droughts or floods, or all sorts of things. And this is just a well that's in a floodplain, so they've made the casing go up 10 feet in this picture, which is a great idea. It's a good way to protect the well from flooding, so the cap can't get overtopped and that sort of thing. But these things are in the news, come and go, and what we find is certainly they cause a local problem in some case, but in general, nationwide, there are 15 million private wells or more out there serving over 40 million Americans, and most of the issues are things that we can deal with that are not in the news sort of problems. The challenges really go back to the rules. What's a private well, and what's considered a private well in different states. Every state has its own well construction code and its own rules. Several states have been proactive in that regard, and some states have really not gotten involved. And so there are different definitions for what a private well is, whether you have to have a permit or whether you have to submit logs. And so, for example, in New Jersey, they require every property that's sold that has a private well have a water sample collected by the state. I'm not sure if it still costs $600, but when they started the program, it cost the buyer and the seller $600. The state came out and collected a sample. They only give the results to the buyer and the seller, and that provides them with a lot of good information. New Jersey gets about 13,000 samples a year that way, and what that's done for New Jersey is they really understand their groundwater and their water quality in the state. The other side of the coin, Pennsylvania and Alaska don't have well construction code or licensed drillers. Now the result of that, if you will, has been that both in Pennsylvania and Alaska, there are a lot of stakeholder groups that have formed who are trying to change that and provide a lot of materials and help to well owners in those states. And so it's kind of a grassroots effort has sprung out of the fact that they don't have the same restrictions and laws that some of the other states do. And this bottom bullet here about, especially in enforcing the rules they have, we see all the time in some states where their resources have been depleted or they don't have enough staff, that they really don't have the opportunity to enforce the rules they have. And so even if a driller is supposed to submit a log, there's a few states that I've worked in where the state maybe has a tenth of the logs they probably should have just because they have no way to really enforce it. So there's a lot of different issues and challenges, and depending on where you live, and I said county health departments are not adequately trained in many states. We also see some states where they've developed their own rules. It might be not a county, but a public health district, like out east, say in Massachusetts, where they actually enforce rules similar to New Jersey or even more stringent. And so what that leads to, though, is in some states you have maybe a county health department that requires you to sample for coliform and nitrate, and that's it. Whereas in another jurisdiction, you may have the full gamut of contaminants under the primary drinking water standards for EPA. So it leads to this very unorganized local approach to protection of public health that, there's no national standard, if you will, or not that we need a national standard, but more, what's the right word, I guess, balanced rules, if you will. So going back to those issues in the news, what really is the problem in most areas and with most wells that get contaminated are these issues. Poor well construction, and I'm just showing two examples here of old dug wells. One has a brick missing. There was frogs in that well, the one on the bottom. And on the top here, it's a well we're sampling with a little peristaltic pump, looking at ag chemicals in this rural well in Illinois. And so it's that the wells aren't constructed properly. This well, has a board across the top, or a little platform they've built. Mice, rats, anything can get in there, fall in the well, and then have contaminated that well. The other issue is abandoned wells, in that especially many rural properties have an old abandoned well that was never sealed. And it'll be properly abandoned. It has to be filled in. Every state, again, has its own code for that and differences. But there are health risks, there are safety risks, and I'll talk a little more about that, I think, as we move forward here. And then thirdly, it's a lack of well owner knowledge and education. So we do a lot of work looking at why well owners don't test. It's estimated that 2/3 or more have never tested their well. People believe groundwater is safe. They don't want the government to intrude. There's a whole gamut of reasons why people don't test their water. My grandpa lived to be 96, all those sorts of things, not understanding that a well, like everything else, has a lifespan. Eventually it's going to rust or crack, or bolts are going to fail. And once that happens and it's not sealed properly anymore, then there's an avenue and a pathway for contamination into those wells. So, our message is you test every year for nitrate and coliform, because of those things can and will eventually happen. So a little bit about well owners and what we've learned. Some of this comes from a project we had funded through CDC to evaluate 100 programs around the country that do outreach to well owners. And so from that and from our own experience and from our work with the private well class, where we've had, over 5,000 people take our class nationwide. Here's some things that we've learned basically, and we wanted to share. So they really, the trouble or the problem, if you will, is that they really come from every social economic education class. You have well owners in rural areas, you have well owners in urban areas. I just talked to the health department in Houston, Texas. They annexed a bunch of area that's now part of Houston proper, and they have 15 years before they'll have services there. So we have all these folks who are on private wells and septic in a very urban situation, for example. Some have lived on a farm or this well their entire life. A lot of folks who come from the city want to move out to the country and have that nice country home and really have no idea what it means to be a well owner. So, it could be, I grew up in a rural area in Illinois on a small hog farm. We had a hand-dug well. Or it could be you grew up in Cook County, which is Chicago proper, and one of the more urban areas one of the most urban areas in the country. So, for example, some other things here. Barb Lukonen and a number of other folks did this large study where they sent out nearly 2,700 questionnaires, 2 counties each in Minnesota, Wisconsin, and Michigan. And they tried some different things looking at, they gave, in the Wisconsin ones, they used a $2 bill and a free test. In Minnesota, a $2 bill, and in Michigan, just a coupon for a free test. And you can see the numbers for the return rate there. Looking at people's attitudes and why they might feel, giving them $2 kind of guilts them into finishing the survey and sending it back in. But that's not the point here. What's interesting is they gave them a laundry list, more than these 10 that are on the right side, of reasons why you haven't tested your well. And nearly a little over 1,100. So they had 1,733 surveys who sent back in, and a little over 1,100 of those folks had never tested their well. So they asked them why. And these are the top 10. People could answer more than once. And so things that you typically would see, well, we've been drinking it for years, so I don't know what to test for. All those down to the bottom one, the one that bothers me the most is I don't want to know. And I actually ran across that with a well owner here working in Illinois. And, the ones that are, I don't know what to test for, I don't know how to test, those are kind of on us to help a well owner understand what they should test for, why they should test, and how they might go about that. Some of the others, like I don't want to know and I've been drinking it for years, is really just putting your head in the sand saying, well, I'm just going to assume it's safe. I liken that to why you need to go to the dentist, but you're not going to go till next year just because you want to put it off and you don't want to find out what's really going to happen and some of those things. So the little graph on the bottom left, 87% were either only slightly worried or not worried at all about their drinking water, which really gets to the problem we have as professionals trying to reach out to well owners. They just don't really see that there's a need. And so because they're not worried about their well. And so we need to change that attitude, if you will. So again, they break down to a couple things. These not knowing, I don't know, really that part's on us. We can give them information. We can conduct our own outreach if we can, and give them information on what to test for, how to conduct a test, give them resources. So that's one side of things. The other one is just the attitude, as I mentioned. I kind of went through this already. So, why are they hard to reach? Well, there's a bunch of reasons. We've asked folks, and these are some of the more common ones. If no one's gotten sick, it's just human nature. They have a perception that if they test and they find something, it's going to cost them thousands of dollars. And the truth is, in some cases, it could. They might need a new well, or they might need to add treatment that's pretty expensive. But in general, like the well I grew up on, it was completely unsafe. When we had a large rainstorm, our water was cloudy. But if you talk to my dad, he would have never once suggested that our groundwater, our well water, wasn't better for us. Matter of fact, his attitude was, it's much better than city water that has all those chemicals added to it, with no understanding that those chemicals are put in there to disinfect and keep us from getting sick. So, that's what we're up against, I guess. So a little bit about aquifers and wells. There are really three types of wells. There are dug and bored wells, which usually are put in an area where there's no, quote, real aquifer, or if it's a very old well, back before some of the modern drilling techniques, we still run into wells that are 100 years old, that are in a pit, and they may be dug or bored. There's also then either drilled wells that are in a sand and gravel aquifer, if you're in an area that's glaciated or along a river bottom, or more typical is a consolidated rock drilled well that's in bedrock. So, depending on where you live, you may have choices. Where I live, we happen to have two sand and gravel aquifers. One's deeper than the other. There's a clay unit between the two. And then we also have at least one bedrock aquifer, depending on, in some places, even two of those. So in other cases, you may have none. And understanding the basic geology of your area and talking to some folks like working with your state geological survey, or in Illinois, your state water survey as well. In other states, it may be your DNR. They go by various names, but they're the folks that are kind of the geology experts in your state. They can certainly help you understand in what area you might have certain issues. And so, it's important to understand those. So as far as dug and bored wells, they're large diameter wells. So they're usually 3 foot in diameter, sometimes bigger. A lot of times the casing is a concrete tile. If you look at this picture, which we got from the National Groundwater Association, there's a hole right underneath the driller's feet. And that's where that bucket rig just took a big section of ground out of that, drilling a 3 foot hole. And so like the horizontal concrete tile that runs under a roadway, you use that vertically, 4 foot sections. That's the typical way a well's installed for a large diameter bored well. And every one of those seams where the concrete fits on top of each other allows water to seep in. And so what you're really doing is the well's so large because it's becoming a storage basin, and water can seep in slowly and build up. And then when you pump it, it goes down, but more water comes in. Water wants to be level and will fill up till the water table. Or if there might be some thin sand lenses in this glacial material at the surface. So these are all examples of a dug or bored well. The one on the upper left is an old hand dug well that's got some concrete blocks over the 2x10s protecting it, which means snakes. If it's not very well protected, even things like possums, or a possum or a raccoon, rats, you name it, can get in there and fall in, and then your water tastes funny, and unless you're paying attention, may not know. This happens to be in a cattle pasture, which is why you see it looks muddy on the front, and all those posts look so bare because cattle are rubbing up against them. So they're obviously there's obviously a lot of fecal matter and everything else in the soil near this well, and because it's a shallow dug well, it's likely this water is infiltrating right into the well. Just not a good situation. So on the right is a bored well that has the 3 foot concrete tile, and this has a cement cap, but you pull that off, and so the first seam, if that upper tile is 1 foot above ground surface, there's a seam down at 3 feet, and depending on how old this is and what the construction code is in that state, it could be sealed for the first with clay for the first 10 feet or so, or it may be that water could seep in this well at 3 feet. And this one on the bottom left looks like a drilled well with a 6-inch pipe. This is, at least in Illinois, one of the construction methods for a bored well now has just a 6-inch casing going down 10 feet, and then it opens up into the 3 foot wide well. And that's to allow for putting clay and less conductive material in the upper 10 feet to help protect it from surface contamination. So here's those two examples. The one on the left is where the concrete tile comes all the way up to the surface, and you can see where those seams are on the side, and the water level's down 20 feet or so, let's say, and there's a pump below it, and they put gravel around it and in the bottom to help water to seep in. The one on the right, they've got just a 6-inch casing going down 10 feet of a minimum, and then you can see the water level is the same in both, and so one has less capacity. but it performs the same function. And so these are considered, at least in Illinois, properly constructed wells today. A sand and gravel well. So, and for some of you, I know we have EHPs from all over the country. So in some states, you're inspecting these wells. You're pretty aware of some of these things, but in other states, not so much. So we're going to go through this, and this is a woven screen for a sand and gravel well, and the distance between those stainless steel wires and the way they're woven is the slot size. And usually what happens is a driller drills a well, he's pulling up samples. When he gets into the sand and gravel, he's grabbing samples of the sand to determine the size of the sand grains, and then he'll slot the well, use a proper size screen depending on the size of the sand. So if it's finer sand, he's going to use a tighter slot size, and if it's coarser sand, he can use a larger slot size. And the water seeps in through the slots. The sand can't. Use a gravel pack as well to help filter out sand before it can get in the well. The advantage of a sand and gravel well is your screen's at the bottom. So typically, if you have, even if you have sand from the surface down to 80 feet, if you drill an 80-foot well and put the screen in, it's usually the bottom 4 or 5 feet. So it means all the water's coming in the well from 76 or 75 to 80 feet below land surface. And all of that material above it gives you some filtering, if you will, and helps protect the well water from surface contamination. So, and typically it wouldn't be sand at the surface, it would start at some depth below. So, but the advantage again is that you're getting the water from the bottom of your well. So this is a typical well log for Illinois. You're required to file a permit and complete a log for every well that's drilled in Illinois. It has information about the pump on the left and about the location. And in this particular well, it's 45 feet. It's mostly sand and gravel. There's 4 foot of topsoil and then 41 feet of sand and gravel. And if you look at number 12, it says water from sand and gravel from 41 to 45 feet, and that's where the screen is. So there's 5-inch galvanized casing or screen from 41 to 45 in this particular well. Okay, so and moving on to bedrock wells. So a bedrock well, if you look at this diagram on the right here, you can see the steel casing it shows in the middle of that figure. It only goes down 10 to 20 feet into bedrock, and that's typical. It depends on the rock. Sometimes you have to case a lot of it off, but most of the time the idea is you only have casing till you get to the bedrock, and then the rest of your borehole is open, and that's to take advantage of fractures. So unlike sand and gravel, where all this water exists in the grains between the sand, so the porosity of a sand might be 30%. So for instance, if you had 100 feet of sand and it was all dry, there'd be 30% of that would be air. But when it's full of water, then you have basically 30 feet or 30% of that would be water if you took all the sand away. But in a bedrock well, it's not in the material itself like it is in the sand. It mostly exists in the fractures. And so it moves almost like pipe flow between bedrock fractures. And so when you drill a well into bedrock, you're trying to hit as many fractures as you can so that you have more water available to your well. And that means several things. One, if you look at the direction these fractures are going, some of them are heading back towards the surface. If bedrock is really shallow in your area and runs back to the surface, it could be a direct conduit into the bedrock formation and then into your well. And also it means it can be influenced over a larger area depending on how much you pump and how much is available in the fractures. So if you only have a few fractures, it could affect move water towards your well from much further away than if there's a pretty stable water supply there. And so you just have to be a little more careful. I know places like in upstate New York, a lot of New York state, there's issues with really shallow bedrock, and the wells may only be cased 10 or 20 feet, and even though they're drilled, the actual borehole goes down to 300. What you end up with is if you only have 20 feet of casing, water can get in that well from anywhere from below that casing at 20 feet all the way down to the 300 feet. So you're getting water from a much wider range and a much shallower depth than you would be in a sand and gravel well the same depth. And this is a typical Illinois again, well log for a bedrock well. And I'll just point out here, the person who filled out this log made a mistake in that for number 12 it says water from shale from 257 to 260. And this is a pretty common mistake. Usually you finish the well, the last unit you hit is where your aquifer is and where your water is coming from. In this case, though, they went in 3 feet into shale and realized they needed to stop because shale is an aquitard and doesn't provide water. And they're actually getting their water from this sand, broken limestone, and limestone from 175 down to 257. So, but what they did here is they used, even though the well goes to 260, the casing only goes to 199. So they went 20 feet into bedrock and they seeded the casing there. And so it's in a solid formation and the rest of the hole is open hole. And so that gets back to what I was saying before. And I guess I forgot to show it on the sand and gravel one, but number 17 is a static water level. In that particular well that was all sand, even though they pumped it, I think at 10 gallons a minute, maybe, I'm trying to remember now, it didn't really draw down any. But here you can see when they pumped it at 25 gallons a minute for 2 hours, it drew down 30 feet. Now the water level in this particular well is still above the bedrock, which means it's artesian, but and there's still plenty of water there. They have water down to 257, so, but it did draw down some when they pumped it. Okay, so the issue, as I mentioned earlier, one of the big issues we have, and what we find a lot of times when a well is contaminated, it's because the well is poorly constructed or it's breached near the surface. Either the caps come loose or there's no seal anymore, or it was put in before some of the rules were in place that are in place today in a particular state. And so we run into a lot of wells that are really old, some still in pits. And so the problem is that those were grandfathered in. They weren't required to be changed when the code was changed. And so those wells typically are the ones where there's a problem. And we don't see a lot of issues with newly constructed wells because of the way construction code's been changed to protect from all that stuff. So it's important to let people know. One of the things we do, we assess people's wells for them, and we look at existing code in their state and try to show them where it might be deficient if it is, and things they need to consider if they're having a problem. So we did a study here in Illinois where I inventoried 1,700 wells in 9 townships in a rural area, and out of those 1,700 wells, 40 were in pits still today and still in use, and those are really a risk. So because not only is a pit or an old dug well that might not be sealed properly at the surface a health problem for water quality, but they're also a safety hazard. People don't have an adequate cap on top of them, or they don't know they're there, and so we run into a lot of problems like this. The picture on the right, that's a goat that fell down in a well because the well was wide open out in the middle of this area, this rural area, and that could have been a child or whatever. And the one on the left here, this is from the Washington State Department of Ecology. They are the agency in Washington State that regulates drillers and well construction, and they have a blog that's really it's really useful. They whenever something like this happens, they post it. I think I'll have another picture from them here pretty soon. But here, have a piece of plywood that just was getting old over top of this large diameter well with a galvanized pipe in it, and this woman probably walked over that 100 times or 1,000 times, but this time it broke, and she fell in, and it killed her. And so you can see here, though, there's some insulation that looks like around the outside of the on the ground, and that old funnel sitting there. It's just not the way to have a well that you're going to get your drinking water out of. And so we run across these situations fairly frequently, unfortunately. So what should you do? you should bring them up to code, or at least recommend it. There's again, there's no laws that say that a well owner has to upgrade their well or make it meet the current code, as long as it was constructed properly at the time it was constructed. So, but we tell people, especially like if they have a well that's in a pit, extend the pipe to the surface, fill that in with clay grout, and then install a pitless if you need to. But talk to others, either a well authority or your health district or a local contractor, to see what you can do to make that protected at the surface. And that's where a lot of the risk lies. The other issue is abandoned wells, as I mentioned. Because well logs weren't required until, this says until the 60s or later. In New York it wasn't until 2000. In Nebraska it was 1986. So every well drilled before that didn't require a log to be filed. So in some areas, like in New York, I would estimate that they probably only have maybe 15% of the logs for wells that are actually in use in New York for private wells. And so in many states, even in Illinois, our law passed in 1968, we find as many wells that we don't have on file as wells that we do. And using that example from before, we found 1,708 wells in these 9 townships going door to door. We did not have logs for 788 of them, so not quite half, but close. And so, that's just a well a lot of times lasts a long time, and if it works, you're not going to spend the money for a new one, especially in rural areas. These wells have been around for a while. So, and like pits, abandoned well is a safety hazard, and not only that, but it's also a liability. Should someone fall in a well, you might be responsible. And so this is what we tell well owners, is that if you have an abandoned well, you should get it sealed properly, because it's worth your investment to do so, to protect your family and your neighbors and livestock and animals. It could contaminate an aquifer, all those things. So they're just a bad deal, and they need to be sealed. Here's some examples. Again, these 2 pictures on the left came from the Washington State Department of Ecology. So there's a horse that got in a well. They're trying to get it out. And then the bottom picture is a man who fell 45 feet. He ended up being fine. A very lucky man, I would say. On the right here are 4 newspaper clippings. The third one's from Midland, Texas. Those of you who are old enough to remember Jessica McClure, it was covered live on CNN for 18 hours as they tried to get her out of a well. The other 3 are all from Illinois, different parts of the state. They make the regional paper, but not necessarily bigger news than that. These days they might, just because of the internet. But these are back in the late 90s. And so people don't realize how often this really happens. But same in counties where our state capital is, in Springfield, a woman died, and a 10-year-old girl died up by Chicago, in Buffalo Grove, which is a suburb. So, it happens more often than not, and if you know of these wells, the problem is having the ability to enforce the laws, even though there are those, to get people to abandon their wells is kind of tricky. So, the next thing I want to talk about are the difference between groundwater professionals and health professionals, and some of the things that I've learned anyway in working with both. And so groundwater is complicated. Sometimes, especially folks that are doing research related to health issues, come into an area and assume that there's one aquifer that everyone's using. So if you're on well water, it means you can compare all those folks together. Many cases there are multiple aquifers, even at the county level, or even a smaller level than that. And so there's also areas where there are wells where there's no significant aquifer. They're on a dug or bored well where most of their water is locally recharged and it's coming from the water table. So the water at one farm to the next could be very different chemically. And so there's really no way to compare some of those things. And just like we have counties here in Illinois where we have wells in 1 or 2 sand and gravel aquifers as well as bedrock, depending on the needs and how much water might be pumped, or given that we have one county where there's a lot of arsenic in the sand and gravel, and so some folks have went to the deeper aquifer in the bedrock just to try to avoid that. So it's just not a straightforward thing. And this thing about Johns Hopkins, I went to a meeting at Johns Hopkins, I got that spelled wrong, where they were comparing private wells and looking at all the issues private wells have, and they used a laundry list basically from EPA for community water supplies. They are not community water supplies. They're very different. They're much smaller wells. They pump from a much smaller, they have different code. All those things, they have to be looked at individually in a lot of cases, and it's not like, the USGS has done a lot of work looking at about 23 major aquifers in the country. Most wells are not in those major aquifers. They're in these smaller units that aren't studied that frequently, that we don't have a lot of information for necessarily. And so the next point here, groundwater samples versus drinking water samples. If you, everyone's aware of what happened in Flint with all the lead issues. That's not a water issue. It's a piping and infrastructure issue. So because the water was corrosive and the pipes had lead, the lead was leached, and so the water coming out of people's taps had lead in it. But the water leaving the plant in Flint did not have lead in it. So it's not the water that they pulled out of the ground or water they were taking from the river. It's different because of our conveyance method and our distribution system. So the same way with a private well, when we go out and collect samples, or a well owner calls Dan and wants to get a well sample done, he'll ask them if they have any kind of treatment, for instance, on their at their home, if they have a softener or a filter or RO or anything else. And if they do, he usually sends them 2 sets of bottles. And he asks them to collect one from an outside spigot or a hydrant that might be near the well, where it's strictly water from the well before it's gone through anything in the house. And that's more representative of a groundwater sample of the water that's actually in the ground. Then he also has them collect one from their kitchen tap that's gone through the softener or filter or RO, or through their piping system and maybe sat overnight. And that's really their drinking water sample. The chemistry can be very different. And I'll show you an example of that near the end here, where we have a set of samples from a private well where they collected an outside tap and inside, and you can see what differences there are. So there's also dealing with well construction issues. It may not have anything to do with the aquifer. In most cases, it doesn't. It's not that the groundwater as a whole is contaminated. It's that the well isn't protected at the surface. They're too close to their septic. There's livestock there. There's all those common things. They're applying something nearby. When you have an aquifer issue, it's usually something like arsenic or, uranium, or I can show you some examples here in a minute. So they're really different things. Where a community water supply, those wells meet much stricter code, and they have to ensure that they're inspected every 3 years to, it's called a sanitary survey, if some of you are familiar, or do that in your state, to make sure that the well's still sealed, everything's like it should be. Well owners don't have those rules, and so most of the time they're not taking care of those things. So, so no information on treatment or bottled water. Well, yeah. So a community water supply has a licensed operator whose legal responsibility is to make sure that the water's treated and meets all the health code that it needs to for EPA. None of that stuff is done for a private well owner. And even what kind of treatment you might use depending on what you might find. And so the point here is that we can both learn from each other. Groundwater professionals can certainly learn from working with health professionals, and vice versa. And so if you're going to have a team that's working with well owners, you really need to have both. My high arsenic example, I don't remember what that was. I'm drawing a blank. Well, I know...
Stephen.
Yeah.
It might be that where we found a high arsenic in the lab, and then it followed along with continued follow-up by some of our staff, maybe?
Oh, sure. Yeah, I think that's what happened. We've had an area here where arsenic was really high. We didn't know the community water supply didn't show any of that because their water came from a different unit. And so, there's just a lot of issues there. So I'm going to move on. I don't remember what the lagoon example is either offhand. So this is just an example of how complicated geology can be. So this is also from Illinois, and the very bottom sand here, the yellow Sankote sand member and Mahomet sand member, is the Mahomet Aquifer in central Illinois, and it sits on top of bedrock. But there's been 3 glaciations that came through Illinois, and each one has deposited thin units of sand. So depending on where you drill, you could hit 1 sand unit, 2 sand units, 3 sand units, and as a driller, he's going to drill until he hits an adequate water supply for the well owner. And a reputable driller isn't going to go any further. So somebody might have one well that's 80 feet deep and their neighbor's well might be 160 feet deep, and somebody else a mile away might have a well that's 250 feet deep. And that's because of, depending on where you drill, you might not hit some of those shallower sands. And so you start comparing water quality in those 3 wells, they're really not comparable as being groundwater samples per se, because they're really coming from different formations that were maybe deposited hundreds of thousands of years different from each other. I know the Sanitarians and the Mahomet have different water quality because of the direction the glaciers were coming, even though they're at the same time. Basically, there were 2 different glaciers that deposited those materials. And so you can tell even by looking at the sand grains which one's Sanitarian and which one's Mahomet. And we see, especially in the Mahomet, we see more arsenic, and that's just because there's more arsenopyrite made up in that material. And so it is complicated. You really need to understand the geology is the bottom line, I guess, here. So here's what I recommend, and we recommend. Develop a relationship with your scientific surveys. In most states, that's going to be your state geological survey, or they may be housed in a DNR or some other agency, but your related groundwater resource agency, and also extension. And so here's some examples: DEQs, DHHS, that's in Nebraska, and then locally more, like extension, or if depends on, again, your state. Even some health departments have that wherewithal, depending on what state you're in and where it's a priority. So also the folks that map aquifers or maintain logs, that may be a university, or it may be your state or federal geological survey. They're a great resource. They want to help. They'll answer your questions. They can explain geology and any water quality information they might have. Because of our lab, we're unique, I think, compared to a lot of states, in that we have a water survey separate from our geological survey, but we work directly with those folks. We're all under the same department on campus at the U of I, and between us, we have a wealth of information about not only the geology and the makeup of the different aquifers and how thick they are, where they're located and aren't located, but also how much they'll pump, what their water quality is. We have a ton of samples from all over the state that give us an opportunity to look at what the natural water quality is around the state. So, and more states are developing those capabilities, or have a monitoring network that they manage. So there's a lot of that data available. You just have to know who to talk to. So a little bit about the private well class before I get into the questions. So if you're not familiar with it, it's privatewellclass.org. It's funded by US EPA, so it's all free. A well owner can go on our site, click on Learn by Email, and there's 10 lessons. It sends 1 lesson a week by email. It's self-paced. It's really up to them. In all, the lessons are about 80-some pages, but we also do webinars like this, not only for EHPs, but for well owners, for realtors, and we've done a few with APHL for labs, and we've developed videos, podcasts, and again, we record these webinars. So this is the front page. Click on Learn by Email on the bottom left, and it takes you to, well, this doesn't. I should say, along with the lessons, we've tried to put together a set of resources that are also all free that are on that same topic. So lesson 1 is about the science of groundwater, how water gets into the ground, the hydrologic cycle, how it moves, the length of time that it spends there. All those issues are covered in this lesson, and it's written in a way that's meant to be basic enough for most folks to understand it and grasp all the concepts. And then it moves through, again, I said there's 10 lessons here. So, for example, under groundwater and well contamination, the first reference there is the Michigan Flowing Well Handbook. Well, like in Illinois, we have a few places where you can drill a well and it'll flow naturally, so it's flowing artesian well, but in Michigan they have a lot. So they actually passed a law that requires you to cap your flowing well because they were losing over 28 million gallons a day of groundwater to just flowing wells and surface runoff. And so that handbook is one of the best resources I've ever seen on flowing wells. It talks about how to cap them, the history behind it, all that sort of stuff. So a lot of hopefully useful information that you can use in addition to the lessons that we put together that are for those things. And the goal of our program really is, for well owners anyway, is to teach them why their well is important and why they need to understand how it works and how to protect themselves from risk. And so hopefully we've done that. And I certainly encourage you, if you haven't taken the class, to do so. I will say that the first year we started this, we had so many sanitarians ask us about either getting CEUs. Well, usually that was the question. How can I get CEUs for this? That we approached NEHA, and that's how we started our relationship with those folks, is we ended up putting a version of our class on their e-learning site, and it's there now. You can take the lessons if you're an EHP and you want NEHA CEUs. You can go take the class there, and at the end of each lesson there's a quiz, and you can get one CEU for each of the 10 lessons. And so, yeah. So as far as, which I'm getting ahead of myself here, we were also approached by the Society of Home Inspectors about getting accreditation for home inspectors, and NEHA graciously is allowing them to use their site because this is all free. And so we have both sanitarians and home inspectors who can take the class there and get credit for it. So, and some of this I probably should have updated. So the workshops have already started. We are hosting workshops around the country. They're 4-hour workshops that are meant for EHPs on how to do outreach to well owners. So it's a much more involved version of this webinar, that part about some of the attitudes well owners have and reasons why they do and don't test. And the other part of it is about this assessment tool that's in the next bullet. And those are worth 4 CEUs from NEHA, and I probably cover that later. We do have a partners page. If you go to our website and scroll over the top, you'll see partners under resources. And we have a newsletter that goes out once a month that's really meant for professionals, not for well owners, and has some information there. We did a webinar last August on lead. We've done a few on other topics like septic systems. They've all been recorded. We used information from EPA and from Virginia Tech that a couple folks that we know there gave us some of the slides we used for that. We also created a lead page. If you just do privatewellclass.org/lead, you can get to this page. Then it's got information about, from CDC and EPA and other sources of information on types of filters that people can use and things like that. So we've created these short videos. So these are 5 to 7 minutes long. How does my private well system work? We have one on how does my pressure tank work that's had over 70,000 views in about 17 months. And so what that tells us is a lot of people have issues with their pressure tank not having the right water pressure, and there's just not a lot of information out there for them to deal with that. So yeah, here's another example. What can I do when my well goes dry? We're certainly seeing that in certain parts of the country, and so we put together some resources there. We have podcasts that we've started. They're fairly popular. We've only got 3 of the 10 lessons done, which is 1, 2, and 3 on this list. We also go on RFD Radio Network and do interviews for them, which goes out to most of the radio stations in the state and regionally, and the RFD radio is through the Farm Bureau. And so we're reaching a rural audience that way and giving them information about different concerns related to wells and abandoned wells. And so, yeah, you can check those out too. When you go to the partners page, it says, do you want to become an outreach partner? Basically what this is, in all honesty, is signing up for our newsletter so that you can get information. We put information about trainings that are coming up, both for sanitarians and for well owners that are going on around the country. As I mentioned earlier, we work with RCAP. They're actually the prime contractor on this grant from EPA, and we're a sub. And so we work with their staff, and they put on workshops. They have staff in every state. And so they put on workshops in about 20 to 30 states each year that folks can go to, and they're all free. And further down the page, it shows our newsletter archive and some resources you can pull if you're interested in putting a link on your webpage. And I mentioned this is our newsletter. We started a newsletter in January of 16. This is the second one, and so this is when NEHA launched our private well class for sanitarians, which is really the same material except that it has quizzes, and there's a blog post on our website about this to show you how to get to it if you're interested in that sort of thing. So this 4-hour workshop I've mentioned a couple times, we've also done it as an online webinar 3 times, November, December, and January. January just 4 months ago. And we plan to do it at least once or twice this coming year. And if you go to theprivatewellclass.org/workshops, it probably doesn't have that listed there right now, but you can also see all the workshops going on around the country that RCAP and some of the other partners that we work with are doing. And by partners, I mean some of the state extension offices where they have a well owner program. And currently we're working with Pennsylvania, Texas, and we're getting ready to also then work with Mississippi State and Virginia. And so you can see what workshops they might be putting on as well. So if you're in one of those states and you're not aware of their program, email us. I can get you a contact at each of those states. A couple other states do have programs that we haven't started working with yet. Rhode Island does, Arizona does. And so we know folks there that we can get you in touch with. So we got a lot of questions from everyone, and so we're going to answer some of those. We won't be able to get to all of them. We certainly want to be able to answer some questions at the end from everyone that's online. And so I'm just going to go into that. And again, the question box that's on your GoToWebinar screen, if you go there to ask a question, Katie's tracking that, and we'll show those at the end. So, so what's considered a private well? Well, here's what it's just any well that's not regulated as a public water supply. So that means it's not a transient or non-transient, non-community water supply. So it's not a school or a factory or a restaurant that's actually regulated. And, it means it's privately owned, and it's not being tested, or it's not under any legal requirements under the Safe Drinking Water Act. So, like this example here, a small business in a rural area with 4 employees doesn't meet the requirements to be a non-community water supply by EPA, and so it'd be considered a private well even though they don't live there. Now that's what a private well is, and actually under our program, EPA is concerned with drinking water from homes, and so the well owners we work with are mostly residences, just because that's kind of a homeowner well is really our target audience. So what do I test for? Everyone has their own requirements and rules, and everyone agrees, I think, that you should sample for coliform bacteria and nitrate annually because they indicate a pathway into your well. So coliform and nitrate aren't necessarily harmful to you, but they are ubiquitous in the shallow environment and at the surface. And so if you find those, it usually means there's a pathway into your well, and that's why they're a good indicator of how protected your well might be. And so that's why we recommend you sample for those annually. You should never find either one at a high level. So, but what we recommend, well, I'm going to show some examples first, I guess. So a lot of states have different issues. So in Massachusetts, for example, they have a lot of arsenic and uranium in their bedrock wells. So they've created this Massachusetts DEP has this website. You can type in your address, and it'll tell you if you're at risk and if maybe you should sample for uranium or arsenic. So that's just one example, and why we tell well owners, to be inquisitive, go online. Your state may have some other resources. For example, Rhode Island, the small circles are all where there used to be orchards where a lot of arsenic is used. And so they recommend if you're in one of those areas, you test for arsenic. And the big splotch that's in the middle third of the state, if you can see that, is actually beryllium. And, I didn't even realize beryllium was a regulated contaminant, but it is. It has a health effect, and it's a primary drinking water contaminant under the Safe Drinking Water Act. So if you're a community water supply in this area, you're testing for beryllium to make sure it's below the health standard, or you're treating it to keep it below. And so a private well owner in this area would want to test for beryllium, which is the only place I know that this is really an issue that I've come across anyway. Other states have more robust information available. So the state of Wisconsin, through their DNR, had Stevens Point University, Wisconsin at Stevens Point, developed this nice mapping tool. So I clicked on arsenic by county, and it shows me for the Wisconsin counties, the upper county there had none detected. Some of them are in the red, which means that the average sample that they have data for is over 21 ppb, where the health standard for a community system is 10. So it just gives you an idea of where you might be able to find information. And for a well owner, if I'm going to move to Wisconsin, I can look some of this information up and see if there's things I should be worried about if I'm looking at a house with a private well. Washington State took it a step further. You can actually see all of these are private wells and analyses that have been done, and you can actually look at the data for each of these through their mapping tool. So there's 2,231 locations here. So if you're buying a house or moving to an area that's near one of these areas where there's a lot of data, you can get an idea what your groundwater quality is. That's one of the things working at the State Water Survey in Illinois. When somebody buys a home, one of the services we provide is we have a database with all our water quality information. It's not online, but if a well owner calls me and says, hey, I just bought a house in Champaign County, it's Township 22 North, Range 6 West, Section 3, I can look on through our own tool that's internal to the survey and pull up water quality, well logs, information that I can say, well, there's a good Glassford aquifer here at about 160 feet. It's going to be hard water. Here's what you can expect, that sort of information. And so more and more of this is becoming publicly available. And that's the other thing I tell people when they're buying a home is in most places it's buyer beware. Very few places have rules like New Jersey does where the state's going to come out and test before a sale of a home. Most places you're on your own as a well owner. And so I tell people never to buy a home on a private well until they've had it tested. Just because we had a well owner call us where they bought their home, they said you only need to test for coliform nitrate to meet the bank's requirements. So they did. It was fine. They bought the home. About 16 months later, she had the water tested for more things. She found out she has 150 ppb of arsenic. So then she calls us wanting to know why the state hasn't done more, why there aren't rules in place to protect homeowners. And that's the example I use a lot, just because it's exactly what can happen if the homeowner or the well owner isn't doing their due diligence. So here's what we recommend. Coliform nitrate, as I said, every year, and then either initially, if you have never tested, or every 3 to 5 years for this larger list. And, copper, if you have copper pipe. And, galvanized piping contains lead. Copper doesn't contain lead, but copper is a regulated contaminant on its own. Most of the time, though, before 2014, copper is put together with lead solder, and so you still have issues if the water's corrosive that it could be leaching lead. And some of these other things, just like I have a series of monitoring wells around the state that we sample about every 10 years. And arsenic, for instance, it's just part of the natural groundwater quality of some of these aquifers. So if the arsenic in a particular well is 40 ppb when I test it, if I come back 10 years later, it's going to be very close to 40. It might be 36 or it might be 44, but it's not going to be 200 and it's not going to be less than 3. And that's because groundwater changes slowly, especially if it's a deeper aquifer. And so having this information gives you as a well owner, or gives a well owner an idea, their pH should remain fairly consistent. All those things. The hardness should be fairly consistent. And if that changes, all of a sudden your pH goes from 8 to 6, that tells you that something's happened near your well or in your well. And so you need to maybe do a little more investigation to find out why. And so that's why we recommend testing for these things, a little more robust sample set every 3 to 5 years. And then we also always tell folks either both before you sampled or after, take your results to your local health department, and also talk to your local health department about what you might need to test for. So for instance, if you're in Rhode Island and the county there may be right in the middle of that beryllium area, they would likely tell a well owner, well, make sure you sample for beryllium, where we wouldn't do that here. So here's an example, and this is a great example of a private well here in Illinois where they've sampled both outside an outside spigot before any kind of treatment, and then inside where there has been treatment. So the things to note here, the sodium's 25.9, the turbidity is 29.8, the color's 48.1, the alkalinity or the hardness is 351, okay? And the pH is, where's the pH? 8.02. So this is a sample from an outside spigot where it hasn't gone through any treatment. Okay, so then if we move to inside the house where it's gone through a filtration, just a 5 micron filter and then a water softener, you can see how it's different. The potassium or the sodium went from 25 to 198 because of the softener. And that's something to note. If you have someone who's on a low sodium diet and they've got a softener to soften their water, they might want to consider the more expensive type of salt that doesn't have sodium in it, for instance. And also you can see here the turbidity and color have dropped. The pH went up just a little bit, but the hardness went down to 0.68 from 350 something. So, running it through a filter and a softener has really changed the water chemistry here. But then this person also has an RO unit. So once you run it through the RO unit as well, now it's been through the filter, the softener, and the RO, you can see most things have a less than sign, which means they're below detection limit, except for a few, the boron. But what's really interesting here is the pH. So taking all that stuff out and which kind of buffers the water, and I'm not a chemist, Dan can probably explain that better, but now the pH is 6.23. So we're fortunate in Illinois that most of our groundwater is at 7.5 or above, so it's slightly alkaline. But if you're in an area where it's a bedrock aquifer like in the Piedmont and Virginia, that's a great example because some of their natural groundwater can be as low as 5.5, and then you're also putting an RO unit on it, you might have some pretty corrosive water is the bottom line. And so understanding how that might affect things is always interesting, and this is a great example of understanding if you just had this one sample, you would think the pH of the groundwater might be 6.23 when it's really not the case. It's all because of the treatment. So, okay, so the next question, and Dan, why don't you answer this since this is kind of your thing?
Yeah, I can try to answer this. It comes up a lot. How do I eliminate the rotten egg or sulfur smell or brown rusty colors from my water? It's probably one of our more common questions. I'm sure you guys all get those types of things from well owners. They usually attribute these things to, the smell is typically attributed to sulfur or sulfate reducing bacteria, converting the sulfate to hydrogen sulfide. Let's see, we said, just look at what we said here. The chlorine is usually used to help take care of the situation. It'll kill the bacteria. It'll probably also oxidize some of the hydrogen sulfide. If it keeps coming back, I've had some people tell me that they've had to have customers chlorinate their well several times. If it keeps coming back, you may have to add a continuous chlorination. The iron is usually attributed to just iron can stain just by itself. As also sometimes attributed to iron bacteria. A growth if it's slimy feeling. The chlorination may help with that. Also, what I would recommend is adding a sediment filter to right after the pressure tank to get rid of any sediment, but that'll also get rid of iron that may have precipitated too. I think tannins is also a thing that comes up sometimes with brown stains. Tannins are like naturally decaying organic matter. It's a different treatment process. anyway, that you can talk with the dealer about that.
Thanks. So what education and outreach is available to inform residents about their private drinking water well, and how do I communicate testing needs to people? So we certainly recommend our program. We've worked with a lot of, we work with all the county health departments in Illinois, and we've, through this work with RCAP, there's a lot of resources available, so feel free to contact me if you want more information. And as I've mentioned a couple times, we do have this 4-hour workshop, and the 6 RCAP regions plan to deliver 1 or 2 of those during this next year, and I don't know if they've set those all up yet. So if you have a need in your state, you know, I know Katie and I have been to a number of states to deliver these, and now in person, and now the RCAP folks have kind of taken that material and are running with it, and so hopefully we'll get a few more of those out. And so yeah, just let us know. We can get you in contact with the person in that region, and you know, they're good to work with. We've got other resources that we aren't talking about today, like this assessment tool we've developed that you can go out. It's kind of like a sanitary survey for a private well, and yeah, you're welcome to use any of it and all of it. So we had a bunch of questions about grout, which honestly has not happened before, and so Katie sent me the questions, and I wasn't clear if that was one person or several, but several went around this dry-driven grout method, which I'd not even heard of, to be honest. And I've drilled a few monitoring wells, but I'm not a driller. So the person who submitted this gave us a link to a fact sheet in Ohio, which I found on my own by Googling. And so I pulled from that, and this is from the state of Ohio. But there really isn't a lot about this method out there, except in Ohio. I think it's more commonly used. It's just not been formally written up. And what happens in the end is that every state has its own well construction standards that deal with grout. So like, looks like I'm missing an E there. Well, I looked at Michigan's standards, and they actually identify when you can use certain kinds of grout in what places. They actually only allow you to use bentonite chips for sealing a well. You have to use liquid grout, for instance, and that's pretty common in most states. Usually it's trimmy grout that has to be used, and I think because these are driven wells, this is a method that maybe has gained some traction, but I couldn't find a lot about it. So you can see here from the diagram, the idea is you're using bentonite chips. So what I can tell you, though, is that if you're not familiar with it, look up the Nebraska Grout Study. And if you just Google those 3 words, Nebraska Grout Study, if you've not heard of it, the Nebraska Department of Health and Human Services did this large study a little over 10 years ago where they used clear plexiglass pipe for the well casing. And they, in different geologies, they tested different types of grout. And they found really, matter of fact, the first thing that comes up is an article in the Water Well Journal, and the quote that's there is that they expected a lot of states to change their regulations because of the study. Because what it shows is in a lot of cases, either the grout dries and cracks, and then it will not re-wet and fill in those cracks, or it goes out into formation. And you know, the bottom line is they found that bentonite chips are probably the best thing to use if you can get them to the right depths. And that many times liquid grout isn't really sealing the annulus like people think they are. What's even more interesting, though, is after that study came out, I just talked to, well, we're putting on a national conference in 2 weeks here in Champaign for private well professionals. So health professionals, drillers, university folks, and somebody from Nebraska is coming out, Tom Christensen, to talk about, Christopherson, come to talk about this study. And as far as I know, not a single state has changed their rules, and I might be wrong on that, as far as grout because of their study. But it's really interesting. It's worth finding information. I know he did a presentation at Penn State for their extension, and the slides are available online. and it's worth going through. But yeah, grout's an interesting thing. We've always put our monitoring wells in with bentonite chips just because of the nature of the way we drilled the wells. We usually drilled a 6 or larger inch hole for a 2-inch well, so we had plenty of room to drop chips through. And we also, we're collecting geologic information as we go and doing some geophysics on those holes as we go. So it's much different in a research perspective type of situation than it would be for a regular house well. So yeah, they work great for that. And after seeing this study, most of those wells were put in the 90s. So after seeing this study, the Nebraska grout study, I'm very glad we did things the way we did them. But I don't think this happens with private wells, mostly because the code says to use liquid grout. And there's definitions on how that's made up, how liquid it is. And I know one of the findings of the grout study is there probably should be more solids in liquid grout. So I hope that helps a little bit. So a follow-up here, ways to grout wells, pros and cons, would a converted well meet municipal construction requirements? These are really well construction code questions, depending on what goes on in your state, because most of that is defined in your well construction code. And as far as whether it meets a well that's put in as a private well would meet municipal construction requirements really depends on your primacy agency, and it would be their decision, depending on if they have a log, if they have information about how that well was grouted and everything else. And so, there's so much more. For instance, we hired a company to put in a large well so that we could do a pumping test. And the community where we were doing this was in need of a well for water supply. So they approached us about having the well converted to a municipal well. And so we had already costed out what it was going to cost us to do the pumping test and then seal the well up. And then they got a bid from the contractor to make it a municipal well. And they took all that information to our state EPA and let them decide if it was an acceptable thing. And so they ended up, paying the difference basically. And in the end, we were done with the well. It was made into a community water supply well. And so it really does, I'm not a driller, and we don't have any drillers on staff. We used to. And so getting into the details of grout, I know that, again, going back, I think it's the Michigan well construction code lists every type of grout and that's acceptable and how they're used and how they're made up. And, I would talk to your local contractor or your state drillers association and ask them for that information. They're much more, give you much better advice than I could. Are there national well codes for installing a new well? As I've said before, there really aren't. Every state has its own, and Pennsylvania and Alaska really have no code. And so what that's done, though, as I might have mentioned earlier, is it's created both in Alaska and Pennsylvania a really active group of grassroots-type stakeholders that focus on proper construction, testing, all those things that well owners need to know. It's like they filled that gap because they can't get their state legislatures to pass, a law that everybody else has. So there is information available in those states as well, but I know even in Pennsylvania, there's a couple counties. There's also no rule in Pennsylvania to have a licensed well driller drill your well, but a few counties in Pennsylvania have passed their own law that says to drill in our county, you have to have a master driller certification from the National Groundwater Association in order to drill here. And that's, at least one attempt locally to make sure that the driller has some wherewithal and isn't, is going to do things the right way. So as far as how to reconstruct an abandoned well for under $300, I really don't think this is possible, but it really depends. When you say an abandoned well, it should already be sealed. That's the first thing. So certainly if it's full of cement or clay, then it's not feasible to use it for any kind of reconstruction. But if it's simply just an unused well and it hasn't been sealed, then you need to really understand several things. Why isn't it being used in the first place? Are there any issues there? I would imagine all the internal components would have to be replaced. You'd probably have to retrench a little line. and test it to make sure that it meets for water quality, and then it'd also have to meet whatever code you would do. And we looked up here in Illinois, you have to have a permit for any modification, deepening, construction, or other work on a well. So even if if you're modifying the well, like you're going to put a PVC sleeve inside of an old iron casing, you have to get a permit. If you have an old hand-dug well and you're going to drill through the bottom of it down to a sand and gravel aquifer that's 60 feet deeper, you have to have a permit. That's not necessarily the case in every state, but you need to check out all those things. And, I can't imagine the scenario unless it's a well that's just being as unused and was used recently and was built to code that you could do all that for under $300. That's the bottom line. I understand money's tight, but, again, source water protection and public health protection are really what should drive the train for things like this. What repairs or changes to a private well require a permit? Oh, so I got ahead of myself there. Here's what it says in Illinois. Our local health departments are approved to accept these permits, and that's usually what happens. And it depends on your state code. So that's really the first place to go. And if there aren't any state rules, there likely aren't any rules as far as that goes. When should retesting be done before remediation? Dan, do you want to answer this? I know you provide some information here. I modified this a little bit, but really it comes down to risk and that sort of thing.
Sure. Yeah. The question is, when should retesting be done before remediation? I'm just kind of looking over what we said here in the answer. Mostly, I think I would think about the risk factors involved. If you had a bacteria test that showed one area count or one bacteria count, it could be that the sample was contaminated during handling or shipping. It shouldn't be during shipping, but during sample collection or possibly testing. I would, before I put a lot of money into well modification, I would get a retest done on that. But also you might want to retest, let's say you had a positive coliform result, but a negative E. coli result. The coliforms are more of a tracking organism, like others have said, but if I had it, I think I would retest to make sure I didn't have E. coli or fecal coliform. Or if you had something that was close to some kind of a level, if you would treat it, let's say it's barely above detection, and you're going to treat anything that had some nitrate in it, you might get it rechecked, or you might get it rechecked if you're testing nitrate in a season when there might be nitrate in the area, but you're testing it in a dry season where there's no likelihood of runoff and things like that. You might test it when there is a chance for it. So anyway, I guess those are some of my thoughts there.
Yeah, and what I was trying to say here is being a value judgment for the well owner. Some people just wouldn't want to mess with it, and they would just go ahead and add treatment. Matter of fact, we run across well owners who've added, thousands of dollars of treatment when they probably don't even need it, but it makes them more comfortable. But if you've sampled and you do have something like, say that's more tenable like arsenic, then, I would sample again just to make sure, again, it can depend on the level. Was it did some treatment salesman come by and take your sample? That's what I was kind of getting at here versus, if this is a well owner, who performed the test and, understanding the relative health risk and all those things go into it. So, it kind of depends. Everybody's opinion may be different depending on what they have and what risks they want to take. So
yeah, a good point there, Steve, about the cost of the remediation. I hadn't worked my way through the whole answer there, but it's a good thing to point out. A lot of people will put it in there ahead of time just to be safe, but if costs are a factor, and they often are, that's where you might want to think about the balance.
Okay. So, yeah, and Dan put some information together. We had one of the questions was about what tips, rules, permits are there for rainwater catchment for domestic use, and I put 3 of the links down here, and we can send these to you if you just send us an email. But basically, you know, it's not actually even legal to catch rainwater in some areas. I know in the Colorado River Basin, all that water's spoken for, and I believe you can be fined for, or at least it used to be that way. I think that law might have changed. But you need to be aware of some of those things. But really the risks are about bacteria and things getting in your well. And so there are people who want to do that, though. So, Dan, anything to add?
Maybe just that, this would also relate to people who are talking about long-term storage of the water. That's where we added the section in there where you would want to maintain a little bit of residual chlorine. I think one of these, probably the CDC link, gives some chlorine residual guidelines, probably at least a half a part per million or something like that. That's all, really.
Yeah, and this is being recorded, so you can get to these once the webinar is up online on YouTube. Get to it as well. So, okay. Oh, I think I skipped. I did. Okay, so someone asked about well disinfection. So, a lot of state and county health agencies have their own guidelines on well disinfection. And so what we did is when we were developing this class, we probably looked at 60 or 80 of these different brochures and flyers and booklets. And I think what I decided is that the Minnesota Department of Health, their guide that I've shown the top of here, is actually about the best one for being complete, easy to understand, going through a step-by-step procedure. And we actually list this. If you go to the private well class website and go to resources under lesson 10, water treatment solutions, you can find this link. And it's about, I think it's 8 pages maybe, but it has a table that shows you how to mix it up. It explains why you can't just pour straight bleach down your well. You don't disinfect unless you need to, which means you've sampled and you do have bacteria. Straight bleach can corrode. It can ruin your rubber seals. It can affect things in your pump. And so that's why you mix it to a certain percentage, to a certain concentration in a 5-gallon bucket before you pour it in your well. And it goes through all that. It even has pictures. It tells you what to do even with, like if you have a softener, to take it offline, to turn the power off. I mean, it walks through every step pretty thoroughly, and they've done a really good job on how to properly disinfect your well. So that's what I recommend. Because for some of these things, it doesn't make any sense to reinvent the wheel. Excuse me. And in Minnesota, they're fortunate as a state to have a public health department that's got some resources so that they have regional staff working with well owners around the state, and they're able to develop some of these materials that are pretty thoroughly done. So, yeah. How do you recommend EH professionals respond when people ask why their water keeps coming back bad or even getting higher bacteria levels? So if it happens continually, that means there's a continual source into the well. Because especially if you've disinfected it properly, where you've ran chlorinated water through all your lines and let it sit overnight and done all the things you're supposed to do, then all the bacteria should be gone. So it's either coming into the well from a source, or you have a breach in your well near the surface that's allowing it in. Typically that's going to be a livestock or a septic issue. We've also as I said here, we've seen tree roots causing a crack in the casing. There's a lot of bacteria around tree roots and a lot of bugs. And so as it happened, they planted a tree near their well. 10 years later or 15 years later, as some of the roots got around that casing, it was PVC, and the roots kept getting larger. It eventually cracked the PVC. So there's usually a reason for that. And, the only solution without drilling a new well would be to have some kind of continuous disinfection. So that's usually chlorine or UV. So that you would add a chlorinator in your home or a UV system. And because in some areas of the country, like around in Tennessee and southern Indiana and Kentucky, there's a lot of springs. Boy, excuse me. There's now a lot of actually home UV units available, and a lot of folks use them. And so it's an alternative. One of the knocks on chlorine is not only disinfection byproducts, but people just don't want to taste that in their water, especially in rural areas. And so they make UV units that'll do the job. Anything to add there, Dan?
No, that's a pretty good answer. Sometimes the questions I'll get about UV, sometimes it'll come up the water needs to be turbidity free, so you'll probably want to put a filter in front of it so it doesn't disperse the light and reduce the effectiveness.
Yeah. Yeah, there's certainly best practices related to that that you probably need to consider. Okay, so we do have, looks like 3 questions from folks on the call, and so I'm going to pull those up and bring that over here and make that full screen. And I could probably make this larger here. There we go. That's probably better. Okay, so the first question is, how frequently are private wells tested for radon? Radon's something I have not dealt with. Typically I think it's something that's done when a home's sold, and it's usually not the well, but it's in the basement and that sort of thing. I do know there is a radon problems in certain parts even of Illinois, but it's not something that's commonly done. So, Dan, do you have any experience with this?
No, sorry, Steve, I don't.
Yeah, I don't either. Yeah, if you want to email us, we can look into it a little further. Yeah, because I know certainly is an issue in some areas. And so we can try to provide some information for you. So the second one looks like a Dan question. I get questions often from well owners asking about cloudy water. Is cloudy water a sign of problems with a well? I usually recommend the caller have their water tested for bacteria about how to address cloudy water. Okay. Dan?
Yeah, sure, I can try on this one. Yeah, it's a good recommendation to have the water tested for bacteria. Turbidity could be a sign of growth like that. What we see in our lab, we see a lot of turbidity just due to iron. So you might have them. It's a really common thing. I mean, most of our samples, 90% of them, it seems like have enough iron to cause some degree of cloudiness. So if it's that orange color, then you could have them test for that. If it's some blackish color, it could be other element. I think it can be iron too, but usually it's often attributed to manganese, maybe some sulfide deposits. But I've done some analysis on some sediment that was pretty black, and it seems like it changes color. I guess if it were some other thing besides this darkish color, I don't really have an answer there, but it's a good answer to have the water tested for bacteria. As far as getting rid of it, what I would do is put a sediment filter right after my pressure tank. I think I touched on that a little bit earlier, but that's just a good idea to protect your water treatment equipment, if nothing else. And I think it'll clear up most of the iron and other sediment problems. If it were a bacteria problem, it's not going to clear that up, but you could see if it occurs sort of in standing water afterwards or something like that. I think that's about all I have on that one.
I forgot to unmute myself. I apologize.
Oh, I'm sorry.
I was talking and no one was hearing me. So the third question, are wells ever designated restricted use based on testing, non-potable use only? I've not ever seen that, especially I've not seen that from the well perspective. Sometimes you see where I was just working with a school this morning where they have some lead issues, and so they've got signs up at their sinks that say, hand washing only, that sort of thing. But it's not a well issue or a groundwater issue. The only I've not seen this particular thing. I do know that there are more areas in a few counties or local health districts along the East Coast where they've basically required testing at the sale of a property, and if it doesn't meet the EPA primary drinking water standards, then the sale can't go through. They can even condemn the home until it's the treatment's added to make it acceptable, which is probably, there's only a few places I think that do that, and they're more local. But that sort of thing is coming, I guess. I could certainly see this happening at some point. Typically, the wells in an area where the water's not drinkable is just treated, but yeah, I don't know of any, to answer your question. Oh my. If total coliform results come back greater than 200 after shocking the well, what could be some of the sources of contamination? I would assume that means you have a direct source into your well, whether that be livestock or septic. I don't know what else,
Yeah, that's the only place I'm going to, Steve. I don't have any other answers for that.
No, because, if we're talking about a private well that, doesn't have, a community sanitary sewer, and it's got a septic, it's got to be one of the two. The only other option is, I know there are some communities, very few, where they don't have drinking water as a community supply, but they do have community wastewater to a wastewater plant. And because I would say it'd have to be, a breach in a pipe from a wastewater line, but that's no different than septic, really. Yeah, I don't know what else it'd be. It's got to be that or livestock. And after shocking the well, that means there's just a continual source. So it's got to, there's something that's feeding, because water, when you pump a well, water wants to remain level, like it's level on the glass. If you put when you start pumping it, the water around the well is higher than the water in the well, so water starts flowing towards the well. So there's got to be something close to the well that has that level of bacteria in it, that's continually providing more of a source. And, groundwater is also always flowing in a particular direction. So it'd be something up gradient so that, over time it continually will keep contaminating that well. Yeah, I can't think of anything else. Okay. That's all we have for today. We're a few minutes over, and I thank everyone for attending. Check our website we have other webinars that we try to do one a month, and most of those are for well owners, but again, there's other sources that we provide too. So thank you for your time. There's our email address Katie's putting up. If you have any further questions or need other information from us, or would like us to look for some more information for you, we'd be glad to do that, and you can reach us there. So thanks again, and that's all we have for today.